Assalamu alaikum wa rahmatullahi wa barakatuh. Good evening, ladies and gentlemen. Welcome on live for our first live session together. Actually, some have requested the non-Arab speakers, whether they are local or non-local, who are living in the country. So we've been doing this live videos for a while now, but we've been doing it in Arabic. Alhamdulillah. The feedback is very good. I'm happy about the time spending together. I'm happy about the feedback. I see more awareness on the health education of the fertility. The questions are very promising and very challenging, some of them. So I'll be more than happy to answer your questions, and I would love to know your feedback on like what would you like us to discuss in the English live videos? Today, actually, most of the questions again in Arabic, few in English, probably because this is our first session in English. So once a month it will be English. So today English, this Monday, coming 3 Mondays Arabic, and then after that we'll do one more English. The questions are basic, actually, not too advanced, I think, because this is our first meeting together. So what I will do, I will talk about fertility as a whole, as an issue, and you will find some the answering of your questions during the talk, all right? Because I wanted to do it hopefully more interesting, hopefully, and more informative. The other Arabic questions, I promise you, inshallah ta'ala, next Monday we'll answer them in Arabic, all right? Okay, so what is fertility, and why there some people have issues conceiving compared to others? Is it a big issue or it is a small issue? Actually, by time, I think basically because of stress of life, probably, and our lifestyle, the couple who have problem conceiving, the numbers are really increasing. I would say the stress is very important, the social stress and personal stress as well. It's very important to know how to cope with this life. Life is beautiful. There's some stress, but the stress are challenging. We need to know what our goals in life, what our limitations. We need to accept certain things. We need to know how to cope with this issue in the community. It is not a stigma. The one who have the woman who has children is not better than you. You're a woman like anybody else. It's a matter of time. The ones who had pregnancy easily on their own, this is a God gift. If, I don't want people to say why I did. Once it is stressed, even with the treatment, the addition of the stress reduces pregnancy rate. So exercise is very important, especially in our community, and I don't exclude myself. Stress is there, but with exercise, inshallah, you have to walk like half an hour a day. It is good for you, whether you go as a couple or on their own times. Lifestyle, like also what we eat, is very important. I'm sure you have read in the social medias about the junk food, about the level of estrogen is high is there, because basically what you eat is what, chicken and eggs, and they're full of hormones, and the more they produce, the more hormones they give to the chickens. So, and we eat these hormones. And also probably other type of meat as well, except fish, because fish we don't give hormones, we take it natural as the way it is. So fish is very healthy. Other foods are also healthy, but let's try to avoid food with added hormones as much as we can. I know there's expenses in life, and That is a limitation as well, but also if especially in a younger age, we need to be healthy, to eat healthy. When you grow up, you'll be healthier. But if you are not having any restrictions in food regarding what you choose in the healthy food at this age, at this reproductive age, we call it reproductive age, then you will continue like that, and then that will have an impact later on in life. So we eat food is something very, very, very yummy, and it is a leisure of life as well. But we try to eat healthy foods, veggies as much as we can. We can have fruits, and we reduce carbs as much as we can. Please avoid junk foods. Whether you want to become pregnant or no, please avoid junk foods, and same for the spouse, I mean, as well, okay? Because we know that is full of hormones, okay? So when we talk about food, it comes the weight, okay? Whether we are very much underweight or really overweight, that affects the fertility in both sex, right? The other thing is, how do you smoke? Smoking with cigarettes or shisha reduces sperm counts, and it affects the sperm motility as well. So, and before the sperm is your health, okay, your lungs, and we know that the smoking or cigarettes have a direct impact of lung cancer, and it's as a direct cause. So we know there's a lot of harm. So if you want to have a healthy life, please avoid shisha, please avoid smoking. I know there's a lot of, whether you can call them cafes or other places, there's a lot of gents who sits and smokes, and even ladies, and they talk and eat, but that is not a healthy way of living in this life, and it does not reduce stress the way you might think. But then you smoke. What else I can say? If you compare the lungs of smokers compared to non-smokers, there's a huge difference in health. So please avoid that as well, and it can be done easily with some courage. And you can go to the clinics. There are many doctors who can help you avoiding smoking. So I said shisha, cigarettes, and even electronic cigarettes is the same. So when do we say that there's an issue regarding conception or getting pregnant? If a couple lives together, when I say lives together, I mean also our community, because there's many couples who don't live together, as the husband works in desert or abroad sometimes, so the woman in the village, and he works in Muscat, so he'll be here in the weekdays. He may go home on the weekends. So when I say 1 year, I mean 1 year of living together. When the couple the woman is not getting pregnant after 1 year of unprotected sex, right? Unprotected, that means you don't use any types of birth spacing, whether in terms of pills or natural, other ways, other modalities. So absolutely no issues, right? Before 1 year, there's some couple might go and investigate if there is another issue, like we know that there's a sperm issue, they've been operated in childhood, or she knows that she has medical conditions like endometriosis, like fibroids, like irregular periods, or age of the woman, like if she is approaching 35 years of age, she can go and get investigated and checked before she completes 1 year, first year of marriage, right? So these things are really important. Or if she had a pelvic infection before, or any sort of family history. Some guys has a family history, like in their brothers or the woman as well, especially if the periods are not regular. So they need to be investigated. If the woman has regular period and she is young, they are living together, they can wait for 1 year and then get investigated, unless there's a lot of stress. But I won't advise before 1 year, especially if they are young, the couple is young in their 20s, unless if we know that there's an issue. All right? Now, the other issue is, how do you know that whether the woman is ovulating or not ovulating? Once the period is regular, the woman is ovulating. If the period is irregular, so it comes every 30 days, 35 days, 40 days, it comes, but it doesn't come regularly, so there's an issue in ovulation. Straightforward. If the periods are regular, every 28 days, 29, 30, whatever, 21 days, some women have short periods, so she is ovulating, right? And once she is ovulating and there's no other issues, then we are okay, all right? When it comes to the time, when is the ovulation usually? Usually it is the week after the period, the week after the woman finishes period, in 28 days cycle. So if the cycle is longer, then maybe you can say 10 days after she finishes period, right? 10 days after she finishes period. So they can meet every third day, because the sperm lives in woman's body 2 to 3 days, and also the egg. Once ovulated, it can live in the pelvis for 1 to 2 days. So automatically they will meet. So we don't have to go and check when is the ovulation happening. I have to check the ovulation kit and other things. That adds a lot of stress. I personally don't recommend it. I know there are people who use it, but I personally don't recommend it. Just live the life the way it is and enjoy life, all right? Once there is an issue, then it can be investigated, and then according to what is the problem, then it can be treated, inshaAllah ta'ala, all right? So that is important. So if you meet daily, the pregnancy rate reduces, because the sperm in the ejaculate is less, and that reduces the pregnancy rate. So every third day is good enough, all right? At the time, like a week after once the period is over, once the flow is finished. After that, it is upon the couple's desire. Yani there's no whatever they want. So what do we do when we have an issue? What I need to say here is it is very important, if you have an issue conceiving, like the woman is not getting pregnant, you need to check, she has to go, or the couple together, they have to go to a fertility specialist, all right? Not a general gynecologist, right? Because it's very important to do a vaginal scan. That is the best test you can do, a vaginal scan, okay? We check on the uterus whether it is normal, it has fibroid, it has polyps, it has the lining of the uterus is not good, or there's any congenital abnormalities. Some women have congenital abnormalities. We check on the ovaries. We measure something, we call it AFC, antral follicle count. So the follicles are the small cyst-like structure, but it is not a cyst, it's a follicle which contains egg. So we know this woman has antral follicle count, say, of 20, 30. I've seen women who have antral follicle count of 100. Of course, that is not normal. That is too high. That's because the women have polycystic ovary syndrome. Okay, so they have a lot of eggs compared to the norm. So if the number of follicle, the number of eggs, of course, we don't see eggs on the ultrasound. We don't see eggs even by the blood test, you can say I'm ovulating now. It's an indication of ovulation, but the eggs, we see them under microscope, right? And also the sperm, we see the sperms under microscope. There's a lot of magnification to see that small structure, right? So we don't see egg on the ultrasound, we see a follicle, and most of the follicles have eggs, all right? So that is antral follicle count, right? The other thing is the local examination. We do insert a speculum. We see the vagina normal. There's no septum. Septum is a structure which divides the vagina. Sometimes we have uterine septum which divides the uterus. So that reduces pregnancy rate. In some conditions, we have to treat it surgically. We have to see the neck of the uterus, whether it is one, normal, healthy, any evidence of infection. We take a chlamydia swab. That is the first goal of investigating the woman, all right? Then after that, we do a couple of blood tests, basically those hormones related to ovulation, okay? So any issue of any fibroid, say that prolactin, it's a lactation and hormone, which increases if the woman is breastfeeding. Okay, some women have high prolactin, some women has high TSH and low thyroid hormone. So we do all this bunch of hormones tests to check whether those hormones are normal, and those are basically related, can affect ovulation, all right? Secondly, we do the semen test. So the guy, he gives us the ejaculate. They shouldn't meet at least 3 days, 3-4 days. If they meet they had sex like a day before, then the quantity of the ejaculate, the fluid will be less, so that the count will be less. And we will say this is an abnormal test, but basically it's not abnormal. It is tested on the wrong date, right? So they should avoid relation around 3-4 days, and then we do he gives the sperms. The sperms, we do check on the viscosity, that is how thick is the fluid, the fluid, and we check on the sperms. We see what are the counts, what are the movement of the sperm, what are the shapes of those sperms, and their ratios of each category. So if it will be either normal, or there's the count is low, or sometimes it is zero. It happens to some people have zero count. So if it is normal, okay, then we know it is normal. We check on the tubes, the fallopian tubes of the woman, all right? Because if the sperm count is too low, there's no point of checking the tubes of the woman, fallopian tubes, right? Because that is an X-ray. We insert kind of a dye or contrast, if you want to say it, and then we check into the uterus, and then we take an X-ray, and that it gives me a color of white. On the X-ray, I can see the uterus, I see the fallopian tubes, and then if the tubes are open, the tubes are like a tube like that, and the end of the tube we call fimbria, they are like fingers, all right? So if they are, the tube is open, then the dye will be spelled in the pelvis, all right, outside the tube. So we know that these tubes are normal, all right? And there are other methods of checking the tubes. One can do laparoscopy, but that is only in certain cases, only when there's a clinical indication to do a laparoscopy. The other media of, we call it hycosi, we insert another contrast, we can see it by ultrasound, but that is it is accurate in a skilled person. Not any person can do it. So if it is a skilled person, he can do it, right? He or she, they can do it. But I personally prefer the hysterosalpingogram, the one we take X-ray. We can see it anytime. So I have the X-ray in front of me. I can check it. I can check it. You can take it to another doctor. I can check it. So it's very, very clear. Okay. So if either it is open or not open. Okay. It is a little painful, but then usually there's a painkiller can be given and antibiotic as well. All right. So these are the main kind of investigations we do for the couple as a couple, and then we give a follow-up appointment. We see we check on the reports, right? These reports are normal. This is abnormal. and then according to what we have, what is our diagnosis, then we see what is the treatment. Okay, we have time to go for the treatment. How many minutes we have? 10 minutes. Okay. So, if suppose everything is normal, right? So I have the woman ovulating, her uterus is normal, the tubes are normal, the sperms are normal, they are living together. There's no issues about other things, right? What do we do? Okay, what do we do? We call it unexplained infertility or subfertility. So how do we treat it? Either we can wait and see, we can give yourself a few more months, especially if you are young, the couple are young, and try for around another 6 months and see. If you, most couple with unexplained delay in pregnancy, delay conceiving, they may conceive on their own, okay? But so we can wait and see a few months, especially if you're young. If you're not young, then yes, we do treatment. There are two treatments. We do we give some pills to the woman, so we induce growth of more than one egg. Normally every month there's one egg formed in the average in most women. So if we give these pills or injections sometimes, we try to induce more than one egg growing, more than one follicle growing, so between 1 and 4, all right? And then we trigger the ovulation. We know we give an injection to trigger the ovulation, so we know the ovulation when it is happening. At that time, the husband will give a sample. He will give a semen. We will process it in the IVF lab. So we select only the best of those sperms. Yeah. So it's like the quantity will be smaller, much smaller than what he gave, but the sperms are the best in it, right? So it takes like an hour or an hour and a half to process it. Once it is processed, we put it inside the woman's uterus or womb by a small tube, very small tube. It's completely painless, right? So we put the sperms into the uterus, in the middle of the uterus, and then after that the sperm has to swim up to the fallopian tubes. So it's like a family uterus. It has to swim into the fallopian tubes. And then the egg normally it up with ovulation it goes into the fallopian tube, and the fertilization, the sperm and the egg, they meet in the sperm, and then sperm inshallah ta'ala can fertilize the egg, and once it is fertilized then it divides into 2 cells, 4 cells, and so on, and then it moves slowly back into the uterus. So this we call it IUI, intrauterine insemination of sperms, okay? And that is one of the treatment of a couple with unexplained delay in conceiving, all right? So we can do that 3 times. If the woman responded normally, if the lining is good, if the sperm was good during the IUI, then we can repeat it again and again. Normally around 3 times, all right? Most couples, they become pregnant within the first 3 months of IUI. If not, then we can go for IVF, all right? So the couple with unexplained infertility, we do ovulation induction with IUI. If not, then it will be with شو اسمه، في واحدة كاتبة it is today not ours. I'm sorry حبيبتي, I'm really sorry, أسفة جدا 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 حبيبتي, جدا جدا جدا. قالوا يبغوا إنجليزي, قلنا نجرب نعطيهم إنجليزي, فما تزعلوا مني, هذا الأسبوع القادم عربي وكل الأسئلة بنجاوبها, سامحوني حبيباتي, سامحوني. this is one of the treatment. لأنه نفس الشيء في جماعة ما يعرفوا عربي, فهيش نسوي, نقسم, يعني أعطيناكم 3 حصص في الشهر وهم حصة واحدة, تمام؟ يعني ما تزعلوا مني, جزاكم الله خير. What I was saying, I was sorry for my patient, Arabic speaking patient. They were a bit upset today because they normally we talk in Arabic, but let's see, we'll see how it goes. Please give me your feedbacks and then we'll decide whether we make an continue an English version like once a month, or whether it is useful or not, and then we'll decide for future, inshallah ta'ala, inshallah ta'ala, inshallah. Okay. If we have an issue on ovulation, then we deal with it, right? So we do ovulation induction, all right? If the couple are not living together, yani most of it, they are normal, but they are not living together, usually I do ovulation induction with intrauterine insemination, because you cannot time it always that the husband will be there at ovulation, and you already gave her some pills to make her super ovulate, right? So we do with IUI. That is much better for the couple in this situation. If we have issues with the tube, then we do IVF, okay? If the woman is young, we can do laparoscopy to see whether we can release the adhesions or what causes the tubal blockage. Sometimes we can do that, but if she is at the mid-30s and the tube is not dilated, like there's a phenomenon, we call it hydrosalpinx, we can easily see it on the ultrasound. So if there's hydrosalpinx, then we have to clip the tubes, okay, because that is unhealthy for the IVF, unhealthy for the implantation of the embryos in IVF, because a tube dilated and there's a fluid inside the tube, and that tube, as you see, I'm the uterus and this is the tube, so the fluid inside this tube goes easily, it leaks into the uterus, and that reduces rate of implantation of embryos in IVF, all right? So whether we do IVF or we do laparoscopy, it depends on the conditions. The polyps, they don't prevent pregnancy, but if there's a polyp inside the uterus, we need to remove it before IVF. If it is, we are doing IUI, we don't have to remove it, unless if the woman has polycystic disease and the lining of the uterus is too thick. So we need to check whether there's a hyperplasia or there's I need to treat her with hormones before I give her any kind of fertility treatment. So there's a couple, we may need to do hysteroscopy before that, right? If there's an evidence of uterine anomaly, so I have like a septum. A septum is a wall dividing the uterus. So I'm a uterus, there's a wall inside me dividing me into two, and that reduces implantation rate as well. And the treatment is easily, we do hysteroscopy, so that's a scope through the vagina into the uterus, and then we see the septum, we see that wall, and we release it. Okay, it's very simple procedure, inshallah ta'ala. Okay, if what else? If there's an issue with the sperms, then it depends on what are the issues. Do I have issue with the count, or with the movement, or with the shapes? What it is. If the count is acceptable, like around 10 million. 10 million is low, but if it is around 10 million and 10% of the sperms moving normally, then I can do IUI. But if anything below that, okay, then it will be IVF. IVF, and we do icsi. Icsi is injecting of the sperm into the egg, injecting of the sperm into the egg in the IVF lab, right? Endometriosis, if the tubes, again, if the ovarian reserve is normal, the tubes are patent, and she is young, we may try ovulation induction. But most of the endometriosis in our country are severe, and most of them they need IVF, all right? Obesity is important to reduce weight before the fertility treatment, because if you if we are overweight, all right? I am overweight. I've been trying to diet 100 times, all right? But if we are overweight and trying to become pregnant, okay? I know there is a lot of people ladies in the community are overweight. That is for sure, okay? And some of them, they conceive and they have children, right? We know that for sure. But when it comes to the group who are having issue in becoming pregnant, and there is an obesity, this obesity, it becomes a major factor, okay? So it needs to be addressed. I know that some women say, many women in the community are obese and they have no problems. Yes, that is because she doesn't have issue conceiving and she is obese, right? But when I have PCO with pregnant, I'm not ovulating, or the ovarian reserve is very low, so the antral follicle count, what we count, are very less, and we are obese, then you need a lot of medications, to make this ovary produce eggs as well. And the quality of the eggs has, in obese women is less, reduced. So, and when I have less quality eggs, that means that the embryo may be also of the low quality, and that affects the pregnancy rate. So this is, nobody is intimidating you, but if we are overweight, we need to reduce weight, please, before trying to conceive, okay? The other issue is once you are pregnant, so you're overweight, say 100 kg, right? There are women, a lot of women 100 kg, and they're in their 20s. This is unfortunately, we've been seeing it a lot. And she is pregnant, she became pregnant, right? So with the pregnancy, the weight will be increased, right? So there's a lot of complication of a pregnant woman with obesity. First of all, the ultrasound is not very clear. We may not be able to do a scan and see how is this fetus growing and what other anomalies. She may have a blood pressure during pregnancy, right? She may develop diabetes in pregnancy. The labor itself could be complicated because I have obese woman and there's a space area for the baby to come through or to be examined, all right? And if she's going for C-section, cesarean section, also that is, it is also a major, she may have major complication from the anesthesia, okay, because of the weight, and from the C-section, so the wound to heal, and we have, and if the abdominal wall and the skin is this much, not when it is this much, there is a difference at wound healing and other issues, and how to go deep into that pelvis, right? So really, please, if the weight is above, then we have to do something. If we are Omanis or non-Omanis, in the community we have less Europeans, right? Most of our food are similar, full of oil, carbs, صح ولا لا? And less salads and diet. We Omanis eat a lot of fruits, but fruits are also sugar. It's kind of carbs, right? So we think it is healthy. Yes, fruits are healthy, but also if we take a lot of fruits, okay, that's also, it is carbs, it's sugar is carb, and then the body will take this carbs and make fat. Okay, so the fat is from the carb. If we reduce the carb, we will use our body fat, and then slowly we will reduce weight. All right. So that is very important to say. I apologize again for my audience, the Arabic audience. So we will meet inshallah ta'ala next week, inshallah ta'ala. I would love to hear your comments about the English videos. If you're happy, we continue, and please write your questions, okay? Today I had only a few questions related to fertility, so I thought to talk about fertility as a whole, and I think I've answered some of your questions already within the talk itself, all right? So we'll see you next week, inshallah ta'ala, in Arabic, and then we'll wait for your feedbacks as well. Thank you very much. Goodbye.